Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
They're polite. I mean, they just take the time for you.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
I like the Angels for what they've done for me.
Angels Care Home Health. We serve patients.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching, and thanks as always to our producer of the program, Jeff Durall. We're at Picken Hall on the campus of Fort Hays State University with Bob Duffy, Fort Hays State Drug and Alcohol Wellness Network Coordinator and now chair of the Tobacco Policy Committee. That's quite a title, Bob. That's pretty impressive with all of the titles and all of the things you're juggling right now. Let's get right to the campus-wide tobacco ban, which goes into effect 1st of July this year, right?
Yes, yes.
Tell us how it works.
Well, it first began as a process in about 2005. We started really looking at our tobacco policy. And of course, we've always followed state law because we are a state university. So it started with the whole 30 feet from the door was the first policy. And then we started looking at it and we wanted to move it further away from the doors because people were complaining about walking through a cloud of smoke on their way to classes. So we went to a system, and I think it was 2012, where we tried moving tobacco usage out to just the outlying parking lots. And what we found is, through surveys and asking students and that the policy is kind of, it's unmanageable because you have to understand what the policy is, you have to know where the parking lots are. And because we're a university, we have a lot of people coming here from off campus that aren't related to the university. They're coming to sporting events, or we're hosting sporting events that are for high schools, and they're not aware of what the policies are on campus. So we found that students were complaining again because the policy was basically not being followed. And we started thinking about it in terms of how do we make a policy that makes sense for the university. And we started doing some research. So a task force was formed in 2013, I want to say.
Okay.
Maybe 2014. 2014. And the policy was actually almost passed immediately. But then we took a step back and we said, okay, if we do this policy and we just put it on the books, it's going to be a policy on paper. It's not going to be something that is going to have the impact that we want it to have. So we step back, and usually the way this policy works is a lot of times policies are put in place, but they're not. You want to change the culture, you want to change something health related, you want to have an impact on the environment, but if it's only on paper and you don't do any education, you don't do any research into it, you don't do any programming around it, then it becomes just a policy on paper.
It really takes some steps to implement, doesn't it?
So it really takes some steps to implement. The other piece that we really stepped back at is we had already had signed contracts with people, including students who would be living in our residence halls, and we didn't feel it was fair to them to have this policy then thrown on top of them. If you're a tobacco user and you're allowed to use tobacco right near your building, all of a sudden we come in and we say, oh, you signed that contract, but this is a new policy on top of it. So we wanted to do some more education with those incoming students as well and give them the chance to make a decision based on what some of the policies are.
You also had some numbers from the survey, I understand, too, that said that, for example, at the time, I guess, 24% of faculty and students and staff said that they used tobacco products, right?
Yeah, and I would guess that that's influenced by who responded to the survey. Because if you're not a tobacco user and you see a survey about tobacco, you're going to probably assume that that doesn't really apply to you, even though that wasn't what the survey was. So to me, that number is inflated. When we do our substance abuse survey on campus, which is an entirely different survey done by the Docking Institute of Public Affairs, we find that about 12% of our students are tobacco users. So, and that's fairly generalizable. I believe the general population is between 10 and 15%. So when you do a tobacco-specific survey, you're going to get an increased number of tobacco users.
And we're talking about all tobacco products too, as well as the cigarettes, chews,
Yes.
cigars, all
Yeah.
of the related items as
That's
well.
I keep on reiterating that this is a tobacco policy, not just a smoking policy. It's not just a ban on smoking.
But it also said in that same thing, and you could address this if you wanted to, 76% said that tobacco-free, such as the implementation coming 1st of July this year, would not have any effect on them. In other words, they either weren't tobacco users or they weren't bothered by the new policy then, apparently.
Yeah, and that's a fairly common number on other college campuses that I've seen. That is a vast majority of people would either welcome such a policy or would support it, or like you said, that wouldn't affect them directly. So
one of the or a couple of the institutions in the Regents institution, KU and Pittsburgh State, have a tobacco-free policy. Is that correct?
yes. And Pittsburgh State, and we've all been a great help to each other in terms of working through the policy implementation and where we are. And we're in a different stage than either KU or Pittsburgh State. Pittsburgh State has already implemented theirs. KU, I think they are going tobacco-free, but I don't think they're quite there yet. So they're similar to us.
President Martin sent out an email on this particular policy, and I quote her: "All university grounds, both indoors and outdoors, are included, and the policy applies to all Fort Hays State students, faculty, staff, employees, volunteers, visitors, guests, and contractors." It's interesting, Bob, and I'd like for you to go into this if you would, that it is a policy on health, but it is more than that. You've mentioned that it is an environmental issue. It is a social justice issue. Go into that with an explanation.
A real simple explanation of the environment was, as I was thinking about being on TV and getting a little nervous and going through my process last night and realizing,
He doesn't seem nervous, Jeff, not at all.
I have to shovel my driveway, and now I'm not looking at the data and the numbers I want to quote and everything. But as I was going through that process, I looked at the snow that fell last night. I was like, wow, everything just looks amazing. And I remember seeing somebody doing an experiment where they took, I think it was 3 or 4 cigarette butts, they put it in about a liter bottle of water, and they just let it sit, and they took pictures of it as time went by and what happened, because it's not only the smoke, the secondhand smoke, that impacts the environment. When somebody throws away a cigarette butt, that filter, which is made of umpteen chemicals and oil products and nylon and plastic and all different kinds of things, is going to be there for 15 years. It's not just a matter that that's going to be there for 15 years, but the tobacco is going to have water come over it. That water is eventually going to end up possibly in our watershed and our,
There'll be a leaching effect from just the chemicals in whatever's left there.
Yeah, so for just this,
So you did it, didn't
today,
you? All right.
I walked over, I picked up 2 cigarette butts, and I filled this was absolute white snow, and I actually have a picture of it when it was pure white. I have a picture of it when the snow was about this high, and one not too long ago.
And this is from his driveway, which he should have been shoveling instead of doing this interview with us.
This was actually from across the street from campus. I did this on my
3
way into
cigarette
the
butts
office
in
this
there?
morning. So that's only been there since 7:10 this morning.
7:10, okay. And
And you can see the coloration of the water.
I don't know whether you can pick
see
this
the
up or not, Jeff,
tobacco.
but the water has actually begun to yellow from this pure white
From pure,
snow.
it was absolutely pure white snow. If I showed you the picture of this bottle, it just looked like it had styrofoam in it
That
because the
is
snow
not
was so
something you
pure.
would want to drink,
No.
definitely.
And
That's
then
amazing.
that goes through our water filter system, obviously, before it comes out.
Oh, that's amazing. So that's an environmental impact.
So
then.
that's one environmental impact among many. And then the social justice issues usually involve the environment because because tobacco is a farm product, you have child labor laws which aren't as strict as the normal child labor laws. Kids 12, 13 years old working on farms can be producing agricultural products, and that's even in the United States. And then you have this one loophole which I wasn't aware of, where there's all kinds of data about the numbers of chemicals that are in the average cigarette, and I believe the number is at like 800 now. And the chemicals that are used to produce the tobacco are highly toxic to our system. Nicotine itself is highly toxic to our system. And we have these kids that are out that are working in these fields, and they're being exposed to all these chemicals. And then you look at the policy our federal government has is some chemicals, even in a Tyvek suit, in a field, are not good enough by OSHA standards for us to allow our workers to touch.
Even in a protective suit?
Even in a protective suit, then they're not. But it's legal for us to sell those chemicals to other countries that don't have OSHA, that don't have the same standards of child protection for labor laws that we do. And there's video of these kids spraying these same chemicals, not wearing shoes, shirtless, walking through a field of tobacco with the plants even higher than they are, and they're spraying it out of a bottle. Wow. And they're just walking around. And it was, when I first saw the video, I literally almost started crying. It was just seeing this, it was about a 10-year-old kid walking through a tobacco field over in Africa spraying it. And the chemicals had been exported from the United States to that country. And the most interesting piece of that is even though a lot of our tobacco products say made in the USA, 25% of all our tobacco is imported back from these countries.
Imported 25%?
Imported back into the United States, grown with these chemicals that we wouldn't let our workers use with Tyvek suits on. And now we're importing it back and putting it in our cigarettes and allowing people to smoke it too.
Wow. So
it becomes more and more of an issue. The more I get into this, and I'm a counselor, and I've worked with people on quitting tobacco, and I've worked with people, and I've seen people that have died from lung cancer, from different forms of cancer that were tied to their tobacco use throughout their life. I've seen the sores on people's mouth from other tobacco products. And I never considered any of this because that's my forte, is working with people on how do you deal with an addiction. And now to look at it in terms of the health, the social justice, and the environment from a different approach. I mean, my ultimate goal with this policy as a practitioner is, I want to increase the health of Fort Hays students and faculty and staff. But to get there, you have to look at all these other things because it's not just about that.
Will the policy be implementable if that could be used?
It makes it easier because there isn't that, well, I can do this here, I can't do it there. It's you can't do it.
You can't do it, period.
You can't do it, period. And it also, it's not just, we're trying to stay ahead of the curve in terms of technology because vaping devices, e-cigarettes have become very popular, and now there's starting to be the research into their health effects. And it's all nicotine, so it's highly addictive.
And they'll fall under this umbrella as well.
They will fall under this umbrella. Anything we came up with in consulting with Ty Patterson, who's been fantastic in guiding us through this process. We came up with basically anything that's not FDA approved for nicotine cessation is going to be banned.
Will there be signage for those visitors and guests who will be coming to Fort Hays?
And that's part of what we're in the process of deciding right now is do we put signs on doors? Do we have plastic sandwich board signs that we put out, especially because we have a lot of guests. We have the Encore Series over in Beach Schmidt. We have athletic tournaments at Gross Memorial and the football field, and we have different venues that have different signage requirements. And we also have a lot of electronic signage here on campus, which we're lucky enough to have. So there will be PowerPoint slides that will go up intermittently around campus too.
July 1st, 2016, for environmental, for social justice, and for health. The campus-wide tobacco ban, July 1st, 2016, with Bob Duffy, Fort Hays State University Drug and Alcohol Wellness Network Coordinator. And Bob, thanks for your work too as chair of the Tobacco Policy Committee in implementing this very important next step for the health of Fort Hays State University.
Well, I appreciate that.
Our community connection. Thanks for watching.
Angels Care Home Health, serving Hays and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
And the Angel Care nurse comes to see me once a week.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
Angel Care has helped to stay home.
Angels Care Home Health. We serve patients.